Hey guys, it's Leah B from Prestige Veteran Medical Consulting. I am a U.S. Army veteran, former CMP examiner, and a physician assistant. So today I wanted to come on and discuss what are DBQs and VA disability. So if you're navigating the VA disability claims process, you've probably heard the term DBQ thrown around, but what exactly is a DBQ? How does that impact your VA disability claim? We're going to break a lot of these issues down, like what it is, who can fill it out, etc., today in our video. So let's just jump right in. So a DBQ is a standardized form disability benefit questionnaire created by VA, which is aimed to help healthcare providers collect data and medical evidence for adjudicators for your disability claim. It allows your doctor, either a VA examiner or a private physician, to document the severity of your condition in a way that aligns with VA rating criteria. So DBQs can be crucial for many reasons. They provide clear medical evidence that supports your claim. They help speed up the VA's decision-making process. You can have a private doctor complete them instead of just waiting for the VA to do it. So the VA is probably still going to do one anyways, but you can ask your doctor to do one. That way there's more than one piece of evidence that adjudicators can rely on to evaluate the medical evidence of your claim. So who can fill them out? So a DBQ can be completed by the VA doctor or the VA contract examiner during a CMP exam, a private physician or specialist. So if you're seeing an orthopedic doctor for your knee or even a chiropractor, this is often a great way to do things if you're looking for a second opinion or again, providing that additional evidence to adjudicators. Maybe you had a bad exam before and your private doctor is willing to fill one of these out for you. So how can these help your claim? So when a DBQ is completed thoroughly and accurately, it provides the VA with structured medical evidence, making it easier for them to determine your rating. So we've done a lot of videos on what happens in a CMP exam in the past and broken down DBQs specifically one by one on different types of conditions. So if you haven't seen those, you may want to check them out so you can see, what happens in a headache CMP exam. We go through the DBQ, right? So these forms, disability benefit questionnaires, include check boxes, measurements in some cases, diagnostic criteria, so that there is sort of clearer and more detailed information. Where can you get them? So we're going to look on VA.gov here in a second, and I'm going to show you where we can gather that information so you can review it, maybe see what's going to be on your CMP exam and what kind of questions are going to be asked, and where you can maybe print one of these off. So again, you can download them directly from VA's website, or you can ask your doctor if they're familiar with them. Not every condition has a DBQ. That's important to realize. So there's, thousands of different conditions and diagnosis a person can have. So sometimes these are done on forms that are related to that condition. So for example, GERD didn't used to have its own DBQ. So it was done on the esophageal condition. More recently, that's changed, and there's now a GERD DBQ. So that's helpful. But that's just an example of how there's not one for every specific type of condition. So common ones like back pain, PTSD, sleep apnea, there are specific forms for those. So let's jump on over to VA.gov so you guys can get an idea of what these look like and where you can find them. Okay. Hang on one second. Okay, so here it is. So let's remember that this is quantitative information, right? So it helps the adjudicators, like we said, determine a rating based on the 38 Code of Federal Regulation, the different rating criteria. It aligns with a lot of these forms, okay? So qualitative data, or I like to think of it like a light switch, flipping a light switch off and on. Is it disability related to your service? Yes or no? That's sort of the nexus or the medical opinion that's provided. Let's say your knee is deemed to be related to service. Your medical examiner says, hey, I agree. I think this is related to their service. The rater agrees, or the adjudicator. This form, this DBQ, helps them determine what that rating is, okay? So over here on VA.gov, we have public disability benefit questionnaires. It says DBQs help collect necessary medical information, like we talked about. Your treating healthcare provider can fill this out. So jumping right in, the cardiovascular ones, there's dental DBQs, dermatologic, endocrinology, ear, nose, and throat, GI. And you can see under each one of these categories, there's a lot of different DBQs like gallbladder, esophageal disorders, etc. So gynecologic, musculoskeletal, neurologic. And again, we have a lot of different videos that show you sort of a breakdown of each one of these. Mental health, respiratory, etc. So let's just jump to the ankle and pop this one open for you guys. Hang on 1 second. Okay, so here's that ankle DBQ that came off of VA.gov. So as you can see, you can open any of those hyperlinks and you can find, that particular DBQ and print it off. And it just has information about your condition. Let me see if I can blow this up a little bit. Yeah, so you're just going to find information about the condition. The doctor's going to fill this out. They're going to put all of your information on here and just history about your condition. I'm not going to go down each and every single point on here because we have individual videos for these if you want to take a look at them. I just want you to familiarize yourself with the fact that where you can find these, what they're good for. So hopefully that will be helpful to you. I guess that's probably about it for DBQs. But again, these are forms that help not only with your initial rating, but if you're going for an increase, it helps them determine, if they're going to do range of motion to determine where you fit in that rating criteria. It can help the adjudicators determine that where you fit in that 38 Code of Federal Regulation. Are these forms required? Okay, let me jump off this screen share. You don't have to go to your own private physician and get one of these. Somebody asked me the other day about a PTSD exam on my YouTube channel. So they were like, hey, if I only see VA healthcare and they won't fill one of these out for me, what do I do? Well, your CMP examiner, if VA determines that there's enough evidence to support you getting a CMP exam, which most of the time they do, they're going to fill one of those out for you at no cost to you. Okay. It might not be favorable. You might not have a positive outcome with that. But they're going to provide that for you. Okay. So I hope this was helpful. Please drop some comments. Again, the most important thing is that this form helps them to determine the rating percentage that you might fall into, what criteria you might fall into, whether you're 10%, 20%, 30%, or whatever. They can fall back to, okay, here's all the data points from this DBQ, and here's where it aligns with that VA disability rating criteria. I hope this was helpful. Please drop some comments. Like I said, let me know if there's any other videos that you guys would like to see. And as always, thank you for watching.